Hello everyone, in this video we'll be going over the evaluation of ascites with this algorithm from New World. Now when we do a diagnostic paracentesis, the first thing that we are going to be looking at is if the leukocytes are 500 or more, or if the neutrophils are 250 or more. And the reason why we do this is because we want to evaluate for inflammatory causes of the ascites. We want to rule out SBP, spontaneous bacterial peritonitis, because this is going to be a life-threatening condition that needs to be immediately treated with antibiotics. We can further investigate the inflammatory causes by doing specialized testing with culture, cytology, amylase, etc. Possible etiologies of the inflammatory cause include infectious peritonitis, pancreatitis, or malignancy. Now, if the number is less than 500 for leukocytes and less than 250 for neutrophils, what we're going to be doing is we're going to be looking at serum to ascites albumin gradient, or SAG. This is going to be the equation for SAG. We are going to be subtracting acidic fluid albumin from serum albumin. So serum albumin minus acidic fluid albumin is going to be the equation for SAG. And if the number is 1.1 or greater, then that is going to be indicative of portal hypertension. Now, the way that I like to think about this is, imagine that this is a vessel. Imagine that the dots that I'm drawing is albumin, and imagine that this is some fluid found within the vessel. So if there's portal hypertension, then the high pressure is going to force water out of the vessel. But if we have a intact vessel, then the albumin is going to stay within the vessel. As a result, the serum albumin is going to be higher relative to the acidic fluid albumin, giving us a greater than 1.1 number, 1.1 or greater. Now, the next thing that we're going to do in order to further narrow down our differentials is to look at the total protein. If the total protein is less than 2.5, then the most likely cause is going to be cirrhosis. The way you can think about this is the liver is going to be responsible for producing albumin, which is the major protein found within the serum. And so, if the liver is cirrhotic, then it is not going to be functioning appropriately to produce albumin. And so, the total protein is going to be lower than 2.5. If the total protein is 2.5 or greater, then that is going to be indicative of heart failure instead. Now, if the SAG is less than 1.1, and we look at the total protein, and that's less than 2.5, that is going to be indicative of nephrotic syndrome. And that should make sense because in the case of nephrotic syndrome, there is going to be a damage to the glomerular filtration barrier, allowing protein to leak out. As a result, we are going to be getting a protein level that is going to be less than 2.5. So I hope this video helps, and hopefully I've answered some of your questions. Thank you for watching.